Hi, thanks for the opportunity to give this talk. It's been a real pleasure to work on this review and it's great to be able to talk about it here. So I'm Angie Sweeney, I'm part of the core review team for the At the Edge of Care systematic review. And as you can see from the screen, there were lots of us involved in the review. And shortly I'll pass over to my colleague Billie, who will talk through our findings and their implications. Before I do that, I'll give a brief overview of our review and the methods that we used. So the key objective was to explore parent and practitioner experiences of support for families with parental mental health needs and child protection involvement, not a review that's previously been conducted to the best of our knowledge. Billie developed the idea for this review from her PhD research. She noted that parents with mental health diagnoses are 25 times more likely to lose custody of their children. These parents were often facing multiple adversities, wider discrimination and inequity, and had social services involvement in their own childhoods. Billie also noted that families often reported highly difficult experiences of social services involvement. She wanted to find out more about this by bringing together existing qualitative research. Synthesizing qualitative research evidence is now a fairly established way of improving understanding of people's experiences and needs and drawing implications. So we conducted a fairly standard qualitative systematic review, and this slide gives some of the headline figures. We searched peer-reviewed and grey literature databases to identify potential references. After rigorous searching and screening, some duplicated by a second reviewer, we had a pool of 41 qualitative studies that met our inclusion criteria. These were being qualitative, written in English, published after the year 2000, explicitly focused on support for parents with mental health difficulties and social services involvement, and including exploration of parents and/or practitioners' experiences. Across the 41 studies, there were over 337 parent participants, most of them mothers, and over 1,300 practitioner participants, including social workers, psychologists, and so on. We used an iterative thematic synthesis process, including coding text, identifying descriptive themes, and developing analytic themes. We held data workshops with 4 mothers with relevant lived and intersectional experiences. These workshops were grounded in the notion that data interpretation varies depending on the analyst's standpoint, and that including lived experience perspectives is critical in gaining a full and rich understanding of the data and its implications. We also held data workshops with our wider team of collaborators, which included people with relevant academic and clinical backgrounds, further grounding data interpretations and implications. I'm going to hand over to Billie now, who will talk through our findings.
Thank you. So the first theme we identified, we called a downward spiral of service intervention. Essentially, our findings showed that service intervention could trigger an influx of stressful processes, which parents felt could actually worsen their mental health and their ability to cope with parenting. They felt trapped because they found that both asking for help and not asking for help could have negative consequences. Here you can see a couple of quotes on this theme. In the first, a mother describes feeling caught in a kind of catch-22 situation, not feeling able to speak openly or to stay quiet. And in the second, the mother talks about child protection involvement worsening her mental health. She says, "I now feel 4 times more suicidal because of what social services are doing." Our second theme we called working with parents, not against them. Relationships between parents and professionals were typically described as fraught. Some parents felt misunderstood and unheard and powerless in their relationships with professionals, and some felt that things like being poor or being a single parent led unfairly to negative judgment. Parents liked it when professionals saw their strengths, not only their weaknesses. The first quote here shows a parent describing how she felt powerless and alone without anyone really helping to put across her perspective. And the second one reflects how parents sometimes felt there was a lack of focus on their own trauma histories and on understanding the impact of this on their current situations. This mother says, "No one wanted to hear about me." The third theme we called support given versus support wanted. We noticed in the data that there was a disparity between the kinds of support parents said they wanted and the support professionals typically discussed offering them. For example, parents talked about wanting practical support with things like childcare, housing, and financial difficulties, but these tended not to be a focus of available interventions. In this quote, the mother says, They wanted to put me on medication, but I was depressed because I was homeless and I've got 5 kids. I don't take pills, so I terminated that service. They never said nothing about helping with housing, so a mismatch between what she was wanting help with and what was offered. In the last theme, we called this constrained by service rigidity. Professionals felt they faced many organisational constraints which affected their ability to work therapeutically with families, and these included things like services being fragmented, underfunding, a heavy pressure on minimising risk, and a tendency to intervene very late once things had already reached a crisis point. As this quote shows, there were sometimes also difficult relationships between professional groups. Social workers were sometimes seen as solely focused on the child, while mental health professionals were seen as too parent focused. Within some specialist services, collaboration was described as more effective, but one international study we reviewed showed professionals in England reported less collaboration than those in some European countries. Overall, our findings showed that families were often facing trauma and adversity, but the focus of services tended to neglect key factors contributing to their difficulties, like financial hardship and lack of practical parenting support. And our lived experience advisors were concerned about how aspects of identity like race, poverty, and being single might affect child protection decisions. Our findings also suggested that a heavy focus on minimising risk and uncertainty could affect practitioners' ability to act therapeutically, and in a sense diverted attention away from the complex wider social context in which social work policy was operating. So what's next? We've submitted a paper for publication on our findings. Our wonderful MSc student who worked on the project, Georgia, completed a thesis successfully on the project. We submitted a funding application for a larger programme of research on the topic, and we're currently creating artwork to depict the findings with our lived experience group members in partnership with an organisation called Traumascapes. Thank you.